molecules, or ions, that have many essential functions throughout the body, including transmission of nerve impulses, facilitating muscle contraction, and maintaining fluid osmolality. Because of their critical functions, maintaining electrolyte homeostasis is essential for normal functioning of the body. Okay, let's review the major electrolytes and their functions. They can be categorized as either cations, which are positively charged, like sodium, or anions, which are negatively charged, like phosphate. Electrolytes can be measured in the urine, cerebrospinal fluid, and blood, and they're usually expressed as milliequivalents per liter of fluid, MEQ per liter. So first, there's sodium, or Na+, which is the main cation in the extracellular fluid. It's responsible for maintaining the extracellular fluid's osmolality, or the concentration of the particles dissolved in the fluid, so it determines blood volume and blood pressure. Sodium also works closely with potassium, or K+, to maintain the cell's resting membrane potential, which is the distribution of ions on either side of the cellular membrane. Sodium's normal value is 135 to 145 milliequivalents per liter. Now, potassium is the main cation in the intracellular fluid, and it's responsible for maintaining intracellular osmolality. Potassium is also essential for neuromuscular and cardiac function, and its normal range is between 3.5 and 5 milliequivalents per liter. Then there's calcium, or Ca2+, which helps with releasing neurotransmitters from neurons, as well as releasing hormones from endocrine glands. It influences the excitability of nerve and muscle cells and is essential for muscle contraction. It's also involved in blood clotting and maintaining strong bones and teeth. Calcium's normal range is between 8.5 and 10.5 milligrams per deciliter. Now, magnesium, or Mg2+, influences the function of both cardiac and skeletal muscles through its actions in the neuromuscular junction, which is where muscles and nerves meet. It also acts as a cofactor in lots of enzyme reactions during carbohydrate metabolism, and it helps maintain a normal calcium level. Magnesium normally ranges between 1.3 and 2.1 milliequivalents per liter. Finally, phosphate, or PO4-3-, works with calcium to form bones and teeth. It is also an essential component of adenosine triphosphate, or ATP, which is the body's main energy source for cellular metabolism, and nucleotides, which make up DNA and RNA. Phosphate's normal range is between 1.7 and 2.6 milliequivalents per liter. Now, electrolytes move from one compartment to another to maintain balance in a few different ways. First, they can move through diffusion, which involves passive movement downhill, or with the concentration gradient, moving from an area of higher concentration to an area of lower concentration without the use of energy. Diffusion can be either simple or facilitated. For example, simple diffusion occurs when the concentration of sodium is lower outside the cell than inside the cell. This prompts sodium to diffuse from inside the cell, across the cell membrane, and out to the extracellular space. The diffusion stops once the sodium concentration on either side of the cell membrane is equal. Now, if an electrolyte requires some assistance to cross the cell's membrane, it can move by facilitated diffusion with the help of a channel protein that opens up a channel so ions can move in and out of the cell. Then there's active transport, in which ATP is used to move electrolytes from areas of lower concentration to areas of higher concentration. ATP is needed because the movement is uphill, or against the concentration gradient. A common example is the sodium-potassium pump, which moves 3 sodium ions out of the cell for every 2 potassium ions moved into the cell, in order to maintain the resting membrane potential of the cell. Electrolytes are ions that have many essential functions throughout the body, including transmission of nerve impulses, altering action potentials of muscle fibers, and maintaining fluid osmolality.